Mama told me that if you want people to like you, do not talk religion or politics. So guess what my life profession is? Talking religion with folks. Well, maybe more than religion too. Maybe it's related to how people see life and those forces or that force or whatever it is that encourages them and journeys with them, and anyway, that to which they look, which is bigger than them, and those fancy definitions of spirituality that you see floating around. But anyway, I am so delighted to be here with you, and I want to thank Dr. Yanku with MD Anderson, the Target Therapy Group, for introducing me to you all, people that are passionate about life. Yes, some of you happen to be journeying in life with ECD, and others are supporting, and others are researching, but the core thing that pulls you together, you're passionate about life and the life that you have every day. And I'm always excited to be with people who are excited and just passionate about life every day. I am a chaplain over at MD Anderson Cancer Center and have been there for 12 years, and so when Jessica Corcoran talked to me, she said, you know, we started out wanting to do something a little different, and then I said, well, Jessica, maybe the folks might be interested in just hearing a little bit about what I do and how I work with people, and just have a wonderful opportunity to work with people, to be with people on their journey while they're living with cancer, which is indeed a chronic illness with similar, perhaps, side effects and challenges that those who have ECD have. So she said, yeah, that sounds like a great idea. So we're going to take a risk here and do that. Talk a little bit about what I have experienced, what I have learned from people who are on the journey with a critical illness, what they've taught me. And as they've taught me, I've had an opportunity, because they let me into their world, to reflect a little bit. And if they truly trust me a little bit, I might nudge them over in this direction a little bit, reframe something and say, you know, I just wonder if you ever thought about this, or if you hadn't, it's okay. And so that's what we're going to do today. We're going to talk a little bit about people who have chronic illnesses and their journey in life and what they've experienced and what they've thought about. My guess is that many of these same issues are ones that have somewhere along the way crossed your mind and maybe crossed your heart as well. I want to begin by saying that my presentation perhaps will be weighed a little bit towards the Judeo-Christian traditions, which is most of the patients we see here, but I have to tell you that I see many, many Muslim patients. And we in the chaplaincy world, spiritual care world, deal with all sorts of patients. And they come with their religious beliefs, and we want to support them in that, nurture that. I tell people the quickest way in the world for me to get fired is to try to proselytize someone to another religion. That's not what I'm about. And so I want to say that about you, too, because if you're in the Judeo-Christian world, or if you're not, if you're a Muslim, a Hindu, a Buddhist, Taoist, whatever it might be, I think there are connections with this presentation today, things that you'll appreciate. There are some strong differences, though. And so I apologize if maybe what I'm saying is not truly fitting or resembling or centering about your religious tradition. But we're all different, and we all approach the divine and that which is divine in our lives differently. And so I want to say that if any of this is helpful to you, wonderful. But feel free to throw it away. Maybe it means nothing to you. Maybe you are like just abhorrent about what you've heard that I might say. All I'm going to do is to share with you some issues and things that have come up along the way. You know, I would never in a million years want to take something away from you, a religious belief or perspective, or something that's very close to you, important that your family has taught you, the religious leaders in your family have taught you. And so if I say anything today that crosses that, please forgive me and throw away what I'm saying. This is only a collection of issues and thoughts and reflections over many years of working with people who are going through life living with a chronic illness. Well, we're not working here. Oh, there we go. Just a few things that we might say about spiritual distress and chronic illnesses. as a spiritual care provider, chaplain, that's what I'm really interested in. I'm interested in, are people experiencing something that's called spiritual distress? Because those are the people that I really want to hear their story. I want to get a sense of what's upon their heart and what they're experiencing on their journey. Several factors are related to that. It's inevitable and totally understandable that people would have spiritual distress when they're living with a chronic illness. And it arises independently of any degree of religiosity or piety. I have patients who haven't set foot in a temple or a mosque or a church ever in their life. They are experiencing spiritual distress because there is something in their life which is bigger than they are that guides them in their life, into which they are moving towards or they feel like has a great effect upon them. It's inherently personal. All of us have a different image of the divine in our life and how the divine has been a part of our journey and maybe has felt like it hasn't been a part of our journey. Spiritual distress truly affects our perspectives on belief and faith and values. You know, I have many patients who say, this isn't working for me. What I'm experiencing, what I'm feeling, what I'm sensing about the divine is not at all consistent with what I've been taught my whole life. And here I am now in the midst of this chronic illness and a crisis, and it just doesn't feel like this has been helpful. Spiritual distress affects our concept of hope, which can take many different fashions. It also truly affects our ability to cope. If you're troubled by what you've been taught all your life is not working for you in the midst of a crisis, then it's going to affect how you feel like you might be able to get through it or beyond it. And also, how are you going to just day by day cope with what you're experiencing? Through the years, there are many things which I've heard from patients talking about spiritual distress in their life while they have a chronic illness. I just want to touch on perhaps the top 5, if you would. This is not David Letterman, but these are 5 that I hear a lot. And so what I want to share with you in each of these is some things which my patients and I have talked about, what we've shared, and some of the things that I've asked them to maybe take a look at to see if it's helpful to them, and to feel free to throw it out if it's not helpful at all. So the 5 would be, why me? Is suffering somehow necessary or useful? What do I do with these emotions that I have within me towards this divine entity in my life? Chaplain, where is the miracle? How am I supposed to live? How may I live on this journey that I'm on right now? So let's take a quick look at each of those. Why me? I have patients who tell me, I have never asked that question in my chronic illness. I stop and look at them for a moment and say, how could you not ask that question at some point? It's not detracting from your faith and your belief, but I wonder, because of what's happening to you and the struggle that it creates in your life, is it not just normal that you might say, I wonder why this is happening to me and not someone else? Well, but more personally, why me? When you ask that question, and I would say every patient at some point does ask that, it leads inevitably to a conclusion, maybe sometimes a shaky conclusion, that maybe can be pulled away a little bit, but at least that somehow there's a divine being that's judging you or me or whoever is living with a critical chronic illness. And maybe even there's retribution coming to you because of something you've done, not done, somebody that you've hurt, or just a myriad of reasons. But there's a sense that maybe it's happening to me because I've been a bad person, or I haven't lived the way I should, or I haven't given as I should have to the mosque, to the temple, whatever it might be, or because I haven't lived the kind of life that maybe this divine would have wanted me to live. Well, that's true of all of us, isn't it? But that does lead us to that conclusion. If we ask that question and we dwell with it too much, inevitably we're going to go to that judgment question. And interestingly enough, when I get the trust of my patients, I will offer them a thought. I'll say, well, does this perhaps have any meaning? That when you dwell upon the question, why me, and that maybe it's the result of judgment and consequences, retribution, somehow that diminishes, does it not? The capacity and the desire of that divine being, that supreme being, of giving you mercy and grace, love, protection. What does it say when you dwell in that moment that it's judgment, it's consequences, it's retribution? Well, doesn't the supreme being, the divine, the God of your life, the sacred being, doesn't that being want you to have grace and mercy? It also, when you dwell with that question of why me, it also, I think, obscures the question, why others? Or why not others? Why just me? Why doesn't it happen to my brother or sister or my aunt or uncle or my parent? But the other is, why not others? You know, it may not have come out in the material that you received, but at least half of my work is in pediatrics. I've done pediatric work all my life, and so one of the things that I invite patients to think about for a moment is, if your disease, your crisis, the chronic illness in your life, if it truly is related to some kind of consequences of the way you've lived or not lived, or retribution from the supreme being, the divine, would that be true of a 1-year-old baby living with cancer? That baby certainly has not, I can't imagine that baby's done anything to disconnect itself from the love of God. Yet that child lives with a chronic illness. So does not the supreme being love us all equally? So think about that for a moment. Is it truly just you? Is suffering somehow necessary or useful? I have a lot of patients who tell me, you know, I wouldn't give anything in the world for having cancer. I've learned so much from it. Well, I don't know. Yes, a chronic illness is useful. I hope it is. I hope that anyone who's living a life that has a chronic illness learns from it, sees life differently, loves differently, has greater passions for all the things in life. Yes, so it can be useful because it increases our sensitivity and our appreciation, our attentiveness to life, to the everyday, even to the mundane. So it is useful, but maybe it's important to distinguish between challenges in life and suffering. Usually challenges come with the opportunity to manage something or to overcome it. Challenges means, well, this is just a minor detraction here, and I can figure out a way through my own senses and through my own intelligence, through my own passion, maybe with the help of a greater group, I can get through this and I can experience life. But suffering may be different. You may have the greatest wisdom and intelligence and capabilities in the world. You may have the biggest group in the world to surround you or whatever, so sensitive to you, but suffering, it may be quite different. So if suffering, I ask my patients, if suffering is necessary somehow, why is it that some of us don't have the same type sufferings as you? You know, if the Creator, your Creator, whomever that may be, the supreme being, the divine of all the world, who creates all people and all things, has decided in the infinite wisdom of that divine that suffering is essential and necessary, why is it that all of us don't have that same level of suffering that you're having to bear in life? Another thought, isn't it the purpose of the divine, the supreme being, that which is greater than all of us, that we have and experience more life as we go through life rather than less life? Is it truly? Could it truly be the purpose of a supreme being, the divine, that my purpose for you in life is that you might have less life each day? It seems odd to me. Isn't it the purpose of the divine that every day, and as we experience life, we are going to be given more fullness in life? If suffering is necessary to make us better, how do we explain it for the innocent and the vulnerable? We talked a little bit about that, the infants. Sorry. What do I do with my emotions towards the divine in my life? I have patients that tell me, I've never been angry at God a single day in my life. I've never been frustrated. I've never been disillusioned. Ooh, you're a much better person than I am. One of the first things I said is, there aren't many days in the work that I do that I don't shake my fist at God. I say, what are you doing? What is it that you're doing? For those of you out of the Judeo-Christian tradition, you know that there's a major religious text in our holy writings called the Psalms or the Psalter. And it's all about people shaking their fist at the supreme being, at God. Just telling God what's going on with them. I don't know if I can bear this. Where are you? What is the deal here? For those of you in the Christian tradition, there was a certain important being who was on a cross and said, my God, where are you? Which comes out of the Psalms, by the way, the Psalter. So I tell people, anger, disillusionment, frustration, whatever it is, that emotion that you're feeling as you're living with your chronic illness, it's created by God. It's a part of your being. The supreme being, God, created you with these emotions, and I would suggest that maybe all things that are created by the divine have a divine purpose, a creative purpose. So maybe it would be helpful to look, what is the purpose then of your anger, your disillusionment, your frustration? Perhaps it's so that you can have divine communication, direct and divine, sacred communication with the supreme being, the God in your life. Many times people tell me, in my illness, I want my prayer life to be so much more than it is. I want to be more devout than I've ever been in my life. And my response to them is, how could you be? I'm glad that you want that, but you're taking medications and you're having pain. You're struggling to communicate. You're struggling, all these things. God understands the limitations that you have in your life at this point because of your illness. Don't set that bar so high that you'll never reach it. The fact that you turned yourself to the divine, to God in your life, honors God so much. Expressing emotions, that anger, that frustration, that disillusionment, all of those things is a passion that sometimes yields insight. I think all of us have experienced times when we just wrung our hearts out in tears, and when we finished, we thought, you know what, I think I understand a little bit better now what's going on with me. I think I have a better direction. Here's one that I reframe for patients all the time. We probably, most of the time, I think, when we express anger, disillusionment, frustration, all those things towards the divine, we come away with a heavy, guilty heart. I can't do that. I mustn't do that. And I think what the divine says, what God says, as God hears our expressions of anger, disillusionment, I think God goes, bless you, my child. That's exactly the way I would want you to react whenever your life is not the way that I wanted it to be for you. What I wanted for you was to have every day a fullness and a delight and energy and love and new things happening to you. And instead what's happening to you is pain, sadness, challenges, troubles, broken relationships in some cases, loss of vocations, loss of avocations, things you've always wanted to do, travel, whatever it is. That's not what I wanted for you, God says. What I wanted for you was to have all of those delights, to have a life that's full, not necessarily laughter and joy every day, but a life that's full of meaning and fullness. That's what I wanted for you. So when you don't have that, when you see your life being eroded away, God would want you to be disappointed. I would want you to struggle with that. I would want you to be frustrated and disillusioned, because you know that I have the power, and in some of the sacred writings I have actually given forth healing and cures. So when I hear you in anger and frustration, I want to bless you. Because if you could just shrug it off and say, what the heck, that's not at all the way I want my children to react when the life that I intended for them is being taken away. Where's the miracle? It is possible, isn't it? Most of the sacred writings from whatever religious tradition you come from have stories of the miraculous healings. We love those stories. I love those stories. I pray for my patients to have those miracles. A couple of things to think about, though. Miracles are initiated, and this word is very important, solely by God, by the divine. Miracles don't happen very often. I wished I could spend my 30 minutes here telling you one miracle after another in my work at MD Anderson. I can't do that because there aren't that many that happen in terms of the miraculous cures. Now, we could use metaphorical examples of miracles that happen whose lives are filled by the experience of living with a chronic illness, of renewed love, other things that are very important and wonderful. But in terms of what most people living with a chronic illness want is a miraculous cure, I don't see very many. I could point to one in 12 years. The one thing that I ask my patients to really think about, though, miracles are possible by the divine. We know that. But even if you look at the sacred writings, which are important to us, notice how few there are in terms of the number of people that the divine, that God encountered through God's prophets and Jesus and others. The numbers that they encountered and the few that were healed along the way. Some were, miraculously. But the one thing that I would ask you to think about is miracles, healings, cures are not contingent upon anything that we do. Who we are, what we believe, what we do, what we say, or any element of space or time. Those have nothing to do with divine healings. Otherwise, we're bargaining with the divine, aren't we? Oh, if I could just pray more, then I'll get the miracle. If I could give more, the miracle would happen. If I could be differently, I want you to know that the cures, those few that come to those who are atheists, come to those who are agnostic. It comes to those who have never even thought of breathing a breath of faith. It is not contingent upon anything we do. Many patients say, if I don't go through this clinical trial, then I will never get that miraculous cure. It has nothing to do with that. God makes the decision. The supreme being, the divine in our lives, makes the decision solely on itself, himself, herself, whatever personification of the deity you might, without any consideration of us. Now, does that not mean, that doesn't mean that you shouldn't pursue therapy and treatment, because that indeed is a miracle of the life that we live, all the treatments and stuff. And it does lead to longer life and health, and in some cases cure. But for those miraculous cures, it isn't contingent upon anything we do. Finally, how should I live? How may I live on this journey with a chronic illness? Much of what I want to say to you in the next just few minutes comes from Barbara Brown Taylor, who is an Episcopal priest, and there's a citation of the article that I take most of this from. She's wonderful, and I highly commend anything she writes. Most of us, when we're struck with any kind of great challenge or great crisis in our lives, and especially a health crisis like ECD or cancer, we are on that journey before you know it. We are looking for that plan of care, and we jump on that wagon, and here we go, and we get all the experts in the world, and we see that destination down there. We're on the journey. And hope means that life can't be about what's all around me right now. It can't be about all this pain and this suffering, and it can't be about all the things that are getting in the way of me having it's about getting to that place down there somewhere, being on the journey. There's got to be more ahead, and if God is God, surely God's going to carry me forth to that place that's somewhere down there. The problem with that I invite my patients sometimes to think about is that as long as we are on the journey and we've got nothing in our sights but that destination, that place down there, somewhere, if we're just on the journey, where we are now is not important. It has no value. It's certainly not sacred in any way. And when we only focus on the horizon, guess what? We miss the fullness of today. We might miss the opportunity to be in a conference room in Houston, Texas, in the Texas Medical Center, to be with a group of people who are so passionate about life, about living fully a life while they also have a chronic illness, that I might miss that. If all I did was look beyond that, I'm just going to sit back and pray every day for a cure for all these people. But I'm not going to go there and be with them, because that's just a trouble along the way there. If on the journey is all there is, then the difference between hope and denial really may be hard for us to discern. You know, that's very holy and sacred, isn't it? I'm going to end with this. I have a chaplain at Johns Hopkins, a colleague, friend, who once made the statement that the purpose of a chaplain is to help people who are living in a health crisis to claim or reclaim the sacred moments in their life. I think you all are about that in what you're doing, and I applaud you for that. And I hope that maybe one thought in the midst of this might have challenged you a little bit to rethink where you are on your journey of living with ECD. Thank you very much.